Okay. Little update. It's been a minute, right? We've dealt with a lot of stuff in the past, since the past video. And we had a toothache. Owie. Um, it's been an ongoing thing. Literally started 3, 4 days ago. We're 9 days away from surgery currently, by the way, just to let everyone know. That's assuming I can get cleared for surgery. That's assuming the anesthesia team clears me and everything, but I did a insane amount of research to the point that I think I was giving myself anxiety to the point that I couldn't even stand it anymore yesterday with everything. And I think they will clear me based on my current symptoms. I almost started feeling like I might have got an upper respiratory thing yesterday, like starting to feel like something like that. And I did go to an urgent care to get an x-ray done of this tooth, but they were like, well, we don't do x-rays. My insurance company and the urgent care both said that they could do x-rays. I didn't specify on the tooth. I said I have surgery in 11 days at the time, and I was like, I need an x-ray on this teeth. Do you do x-rays? And they said, oh yeah, we do x-rays. So all the nurses there were sick, and it's just like, oh god. So yeah, that's kind of where I'm at. Like, I literally quarantined myself this entirety of this time, so if I did get anything, it would definitely be from there. But it could also be, just like, I don't know, maybe just complete nerves. And I did start this antibiotic for this tooth. We're 2 days in on the antibiotic now. We just took the sixth of our 21 capsules for it, kind of thing. And we're spacing them out evenly. And the very last capsule for this is when I changed my anesthesia clearance date too. So I have to go out the anesthesia and be like, hey, yeah, no, I'm good. What do you mean? I'm completely healthy. What are you talking about? This tooth, when I talked to my primary care physician and the people at urgent care, they both said they think it could be a localized infection. The person at the urgent care looked at it twice. That was my only exposure because I had a mask on the entire time too. But yeah, it's just really upsetting that I did that now in retrospect, and put myself at risk. But I mean, also the tooth thing just honestly felt like that was the end, because you don't have time to extract or get a root canal 2 weeks prior to surgery and still be cleared. I would have gladly gone to get this tooth pulled just on the off chance and just been like, okay, I'm going to get a dry socket. Cool. It's easier to deal with a dry socket than a surgery that our government it might ban later. It's been that much level of stress. The ankylosing spondylitis continuously getting worse for me. I mean, the longer I wait, the worse it's going to be. And I just, it's so much at play here that the only thing that I can think is, yes, we need to continue with surgery. But there is a scare factor with me after doing more research on this tooth infection. If it was an infection, prior to the tooth pain, there was swelling in the lymph node. There was no swelling in the lymph nodes. There was no fever, right? None of that. But there was pain that started getting pretty dramatic in a 32, 36 hour, 48 hour window. Not quite 48. I didn't quite have pain for 48. Well, I guess maybe no, I took care of it sooner than that. Starting the antibiotic and everything. But yeah, it's just it was just a lot to go through all of this so far, and it's still a lot to go through with, because it's just I don't know how everything's gonna play out. I had these symptoms of okay, after the tooth pain, then it started getting radiating, more throbbing pain. I'm like, okay, this is looking bad. I did stop an NSAID medication for inflammation 2 weeks prior to surgery, so I was like, well, maybe that's what's triggering this a little bit. I did have some skin discoloration going on, and again with the tooth pain, I'm like, oh, that might be a bad infection because of the other symptoms. I was having a racing heartbeat kind of thing, but every so often, and I think it could have also been anxiety doing that, because yeah, keep clearing my throat. That's fun. It's it's just been a lot. It's like it's been a lot of like in my head and trying to diagnose everything without like getting a hold of someone. And like I talked to my dentist um Monday morning after this tooth pain started, kind of thing. And they were like, "Oh yeah, well I'll talk to the dentist." And then they talked to the dentist. They were like, yeah, we can't get you in until after surgery. We can give you an antibiotic if you want to feel better about it." It's like, "Oh, okay." Um, I just wanted imaging done just to have the clarity and peace of mind because I have to kind of know everything because that's the type of person I am. I like to have as much control over a situation as I can. I didn't want to have to double up on antibiotics if I didn't need to, kind of thing, if that makes sense. Um, but after starting the antibiotics, my lymph nodes did swell a little bit for like a day, about a day, um, but not like crazy swelling or anything. And that kind of signals that um, maybe there was like some bacterial issue. The doctor at the urgent care, when they looked at my tooth, they said, "Oh yeah, it looks like there's stuff leaking out of it." It's my most unattractive tooth, by the way. I have a lot of nice teeth, but like at the same time, it's just like it's just like I don't know. It's scary because I wanted to go into the situation with full and utter confidence of I'm doing everything right and I know I will be cleared and I know my healing will go well and I'm going to make sure my diet is as perfect as possible so I don't have as much swelling after surgery, kind of thing. And now I'm at the point of I don't know, you know? Um, but I did finally talk to my primary care physician. We had a conversation about like everything that I looked up into localized versus systemic infections because that was my big concern. If this is already a systemic infection, then proceeding with surgery would be dangerous and un not intelligent, right? Not the right move. And so as much as I want to get the surgery done and just get it out of the way and not have to read the news for the next 3 months and be like, I wonder if my surgery's banned now, you know? Um, I probably wouldn't be able to get myself to just do that. And at the same time, the GoFundMe that I had up has hit its goal, and that's amazing. And I used the money to book a hotel on the 22nd and the 23rd, um, just so I'm able to go to the surgeon and like have my mom have a place to stay after I have surgery so she can bring me home, kind of thing, and not have to, so like, but like at the same time, this hotel thing ended up being almost $400, and it's reimbursable, but like aside from like $35 if I cancel, um, within like 24 hours of when I have to head out there, kind of thing, almost. Um, so yeah, it's a little bit sketch because so now I'm on this antibiotic, right? My anesthesia clearance is on the 20th. I'll be finishing the antibiotic the morning of the trip out there. I'll have to leave the house at like 4 a.m. It's going to be a massive snowstorm for, I don't know, from today until then. um, and so I'm just going to have to rent a car and be able to drive it there and back and like have no issues with that somehow, right? Um, and it's a little scary, it's a little concerning, and I don't know how it's all going to play out in the end exactly, but hopefully everything just works out, you know? My concern with a localized infection, and this is something I think other people could learn from, is that like I was like, okay, well, how soon does an infection come back if there was an infection that was localized, right? And so it's one of these situations of like, oh, it could come back in 1 to 3 days and like stuff like that. And it's just like, oh, okay, so if this is the case, and I have to make sure that the tissue in my face is healing correctly because like the first 2 weeks you can't have any bacterial exposure without potentially compromising your healing, needing revisionary work, etc. And that's something that I don't want to have to like go through and do, obviously. Um, but like at the same time, it's yeah, the bacteria could come back in days. If it's going to get to back to like where it was at, you know, 2 3 days ago for me, that's something that's going to take time. And then even if it were to go systemic, it takes like weeks to months of a constant like toothache kind of issue. My primary care physician kind of agrees with me that I said, well, do you think I need to wait 6 weeks post surgery to get a tooth extraction? They kind of agreed with that. Um, but like in an emergency situation, I still think it could probably be done 2 weeks after surgery, like after that window kind of thing, because this tissue is not as affected by an infection kind of thing. So like even if I did start getting like bacteria kind of stuff, it's not going to like affect my healing. But at the same time, I probably would like to get the tooth out just so I don't have to deal with it, you know? Um, so I don't know how that's all going to play out, but I'm going to have to play it by ear, and I'm going to have to do more research getting closer to that point if we proceed, right? Um, it's a lot up in the air right now. And like I said, I wish I could just be like confident and comfortable and like be like, okay, we know we're going to get this. We know we're healthy. We're going into this. This is going to work out, right? And now it's like, okay, we have a ticking time bomb in our face. Um, there's a chance that, I have to reschedule because of my health or whatever. But ultimately, like my primary care physician, we had a conversation about this, and I thought, like, okay, I'm pretty sure we're going to go through with this. I'm pretty sure I'm going to end up being cleared. And my primary care physician said they're not is a non-zero thing with the tooth, but they're like, I don't, it's hardly a concern for me. So, I don't know if I got to the point that I had so much anxiety yesterday that I was like feeling like, oh God, I can't breathe, and like laying in bed with like my heart racing kind of thing a couple times. But like, yeah, as far as like the bacterial stuff with the tooth, after 24 hours on the antibiotic, I was pretty much feeling almost 100% again. Um, there was like pain down my face. There was this headache, this localized headache on the side of the tooth. Um, and pretty much like anything else, there wasn't any of these other like feelings or concerns of like something being wrong. The one thing that does still feel wrong with it is that I still have like a lot of tooth pain, but that kind of plays more into that the pulp under the tooth is damaged, and that stopping the NSAID medication probably is showing that like I have more inflammation in that area, and that is just like making it a louder pain essentially, right? Um, it's it's a lot. It's a lot to like juggle, and it's a lot to be like concerned about and whatever. And so I don't want to have to end up being like, okay, I rented a car to come out to my anesthesia clearance to make sure that I can get there, and that it snows so bad that I wreck the car, right? That's scary. I don't want to get to the anesthesia clearance and be told, well, you can't be cleared. And it's like, okay. I don't want to, and but like even beyond that, I don't want to have to like between the anesthesia clearance on the 20th to the 23rd, I don't want to have to like find out, oh, this tooth pain's coming back like full force and it's actually really bad, and like even if I take another course of antibiotics after surgery, I don't think I'm going to be okay in the next like the second week, when I definitely can't be having infections, the like bacteria stuff reaching my face, if that is the case of all of this. And so there's that. And then also, I don't want to have to go to the hotel that could be reimbursed if I could save the money for the hotel for the next time that I get scheduled, if that's what's required. But we're going to play it by ear, and hopefully like, the anesthesia team can like really solidify that I'm going to be okay for me. I mean, I'm being told by how many people that I'm probably going to be okay too. And yeah, it's just I just wish I felt it more. I just wish I felt totally 100%. There's still a little bit of me that just feels off, and like I just don't know how fast this like tooth pain's gonna come back again and stuff like that. So there's concerns and like worries, and I think it's rightfully so. And I just I think it's kind of crazy if I go through with something and I know I'm not okay too. So I don't really want to do that, but at the same time, I feel like the governmental pressure to take this away from me is very much real, and it's terrifying, and I'm like so close to the line on this. And we just had like the sports hearing with the transgender sport like athletes or whatever, like all 27 of them or whatever it is, and that decision alone can make decision making for other laws and like insurances and whatever handle things a little bit differently. And it's really kind of scary times for someone like me, and things just continuously get worse for someone like me. And I just, wanted to be passing. I wanted to be okay enough in public to be confident in public, right? And at this point, I don't even think cis women are okay and confident in public. I feel like some of them are also being targeted and harassed for being trans if they're not, and that's just the world we live in now. And it's sad, and this is still more, I want this for me as well. I just, I felt like I've needed this for like 8 years, almost, I guess 9 years now, that I've like really wanted to pursue it, that insurance didn't cover it, that I've asked about it multiple times. Oh, some insurances cover it, but not yours, like things like that. And now I'm at the point that it's like, I'm 9 days away from getting this. You know, um, I I hope everything works out, and I'm sure a lot of other people hope everything work out with this as well. And I have a lot of people on my side and support, and I feel like it's not just me in this anymore. I feel like the people that have contributed to the GoFundMe are also like part of like my success or failures at this point. So I have to like really put in a little bit more work on myself and make sure to stay positive and like take that moment to relax, and these important steps to not like totally nuke my immune system with stress kind of thing. And yeah, so like I said, I mean, I wish I felt better about this. I wish this were the victory lap I always wanted kind of thing, and I felt super confident and just really in the zone for it. But I think at this point, the next step for me, the next point that I'm actually going to be like excited about this is when I'm literally in the like I'm being wheeled back to the like when the day of surgery comes and I'm there and they say you're cleared. I think that's the next time that I'm actually truly going to be excited about this, because there's just so much up in the air, so much worry, so much concern. I have to get 80 grams of protein a day. I have to keep, like, I don't have to, but a low carb, low sodium diet, making sure that I go out of my way to like eat healthy enough to make sure that my recovery is as good as possible, right? And then I have, like I said, stupid toothache that I could have got rid of at any point. And is it a bacterial infection? For sure, I don't 100% know, but the signs with the lymph node swelling, it feels like it probably was. And I just wish I could have confirmed it with some imaging. I hope that it doesn't come back like full blown kind of thing. And so there's these worries and concerns and these things that there's nobody that can give me like an absolute certainty. But from the people that I talk to, like I said, they're pretty confident that this isn't going to be an issue, that I could get the tooth dealt with 6 weeks after surgery. It's not going to be a problem. I might have a little bit of tooth pain here and there. I'm already going to be in a lot of pain, so it's like, why not? So yeah, and I'm just going to continue to do everything that I need to do. I have protein powder added into this. I got a peanut butter toast on 7-grain bread. I'm doing everything that I kind of can. These antibiotics are making me like slightly nauseous, and I've been dealing with like chills a little bit yesterday. I was dealing with chills prior to taking the antibiotics as well, and that's like the big symptom kind of thing that makes me concerned, because I have had no fever this entirety of this time with this tooth, and that's like the big giveaway that I have like a bad infection kind of thing. Swelling, I didn't notice like any major swelling in my face or anything. If anything, I might have had like a teeny little bit, but I think it was a lot of like frowning. I looked at my pictures from those days and I was just really sad and upset. And like the day I started the antibiotic, I I don't think I've ever like cried that hard in my life. If I'm being honest, and I'm not like trying to like over exaggerate. I just felt so defeated. I felt like once I take this antibiotic, this is the end of this. And I've worked so hard for this, but I have to manage the tooth. And I took the antibiotic and I was just like, but realistically, I'm showing that I'm trying to stabilize the tooth prior to surgery. It's better to stabilize a tooth than have it extracted or have a root canal. Um, yeah, it's crazy too because like I was literally at the dentist like 2.5 weeks ago, and I was like, hey, look at this tooth, do some imaging. They didn't see anything wrong with it. I asked them like, is there a possibility that there could be like a developing infection? They're like, well, the real answer I have to give you is like yes on that, but we don't see anything, and like the reality is you're just going to go on, you're going to get your surgery, you're going to be fine. If you need to do something with the tooth, you can do it after. So so just staying healthy, avoiding exposure from people, still quarantining myself, lonely times, reading the news and somehow staying sane. And yeah, we'll see how things play out from here. I just wanted to do a little update video because it's been so long. Plus, we're getting so close. And um, yeah, we'll keep you posted. I mean, I might not even do another video. This might be my last one. I feel like this takes a bit of time out of my day, which is good for me. It's a distraction. It's something to keep me um, occupied with for a moment, not hyper focused on these other things. At the same time, it probably is a little bit too much time to be taking on my day when I have to do meal preps and have other things to worry about. But we are going back to bird watching. We are going back to doing some yoga, and we're going to just focus on the end goal. And as of right now, I have to keep this in mind because my mind is already just going back to like, this isn't happening. We have this going on. This isn't happening. This is too much pain. And they're not going to care about pain, from my understanding. They're not going to care about, a localized stable infection. Probably. It still seems so scary because it's like face work. Some of that radiating pain kind of went up my face from yesterday where it was like throbbing and stuff. And they are working in this area, but at the same time, when you take an antibiotic, if you did have a bacterial infection, it's more that it has to do with like the inflammation of the nerves and like the radiating kind of what happens from there kind of thing. And it's been a lot. It's been a lot of learning and like research and stuff that it's just like, it's not fun, right? I'm sure this isn't that much of a fun video, but at the same time, I want to give like the reality of my experience. A 34-year-old trans woman trying on their last leg to make this surgery work and happen kind of thing. So yeah,